Welcome to Marrow Masters Season 15, sponsored by Kite, a Gilead company, and Bristol Myers Squibb. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplant, from diagnosis through survivorship. Season 15 of our show focuses on CAR T cellular therapy. This innovative and life-saving treatment is gaining momentum and has become a first-line course of treatment in recent years. We will dig in, learning more from clinicians, survivors, a caregiver, a nurse, and a psychologist. This season will offer education, insight, hope, and so much more. Here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. So today we have with us Liz Monks, a licensed psychologist, the director of the Oncopsychology program at the University of Kansas Cancer Center. And Liz is going to talk to us today about the psychosocial emotional needs of patients and caregivers throughout the CAR T experience. Welcome, Liz.
Hi, Peggy. Thanks so much for having me. I'm excited to be here.
Great. Let's get started. So, Liz, let's start at the beginning. Let's talk about distress before CAR T cellular therapy.
Yes, I think the distress prior to CAR T cell therapy is probably when things are maybe the heaviest for patients, just because so many patients are coming into CAR T cell therapy already having gone through a whole lot. They've probably already failed treatments beforehand, and that is not a term that I necessarily love using. That's a term that sometimes patients come in using already, or their teams have used, or their doctors have said, they've failed this chemotherapy or they've failed this treatment option. And I never want to tell a patient that they've failed anything. So
sure,
sometimes it's a bit cringeworthy to say that anybody's a failure, but that's sort of the reality that many of these patients are coming into CAR T cell therapy with their disease not being responsive to many other things already. And I think the emotional weight is already very heavy, with a lot of distress of already having gone through the shock of having a cancer diagnosis and, the anxieties, the depressions, the fears, the worries, the impact of that psychologically already, and then, dealing with a diagnosis or a cancer that is not particularly been responsive to treatment, and just the emotions that go along with that. It's weighty already before you even get to CAR T. It's like a prereq, right?
Sure.
Emotional distress, check. Here I am with CAR T now on the docket.
Wow, I really had never thought much about that word failed. That is so true, Liz. And you're getting people sometimes where they're not bright and shiny at the beginning of the journey. They are tired, they're worn down, they're scared. But, we're going to talk more about CAR T throughout this whole season and the hope it's also giving people.
Mm-hmm.
So, there are the pessimists and the optimists. I'm sure you see a big difference in your work. Tell us a little bit about the two frames of mind.
Mm-hmm. And I think there's a middle frame of mind too, right? There's the people that are like glass half empty.
Mm-hmm.
Maybe the people who are more pessimistic, the glass half full, the optimists. And then I always say there are the people who are like, the glass has this much in it. Maybe the realists?
Yeah, I never thought about that.
The people who are like, it is what it is.
Mm-hmm.
And I think the people who are the eternal optimists, they tend to be the ones who are like very excited about CAR T cell therapy.
Okay.
Not that everyone doesn't have a little bit of that, I think, because new therapies, new options, CAR T in general, I think, is at baseline offering people who might otherwise be in potentially hopeless situations, hopeful opportunities.
Mm-hmm.
So regardless of how you see the world, what lens you have, I think there's a lot of hope with CAR T in general. But the eternal optimists, I think, are like, this is great. I have this option. Like, can you believe it? You can take my cells and send them off to a lab and genetically re-engineer them. And, the people who are glass half full are really seeing this as like, wow, I'm really grateful that I have this opportunity. And the folks who are maybe a little bit more glass half empty or maybe a little bit more pessimistic, I think might rightfully so be thinking like, what if this doesn't work along with everything else that hasn't worked? And that is a very real concern or a worry too, because there are no 100% guarantees. So I don't actually fault those glass half empty folks for having worries or having concerns about what the side effects may look like, or worry about this not working along with the rest of the things that haven't worked. And then there's those middle ground people that are like, yeah, great, awesome. I'm really glad that I have this opportunity. And this could also not work. And this does seem to come with some pretty heavy duty side effects that I haven't seen before. And there's a little bit of mixed emotions about it.
The realists, they really are the realists when you break it down. And gosh, it makes me think, how much does your attitude really affect what's going to happen?
Yeah.
To a certain extent, of course.
It definitely plays a role. And I think those of us who work in this world of psycho-oncology, there's a lot of patients who I think get a lot of outside pressure to have a positive attitude. Like, people will be like, just attack it with optimism and you got to be positive and you have a good attitude. And that does not always reflect the reality. Having cancer is not positive. This is not something anybody asks for.
It's hard.
It's very hard. And what I always tell patients, what I know many of my colleagues tell patients, is there is no research out there that supports that you have to have a positive attitude to successfully beat your cancer or get through your cancer treatment.
Okay.
And so we say you have to embrace everything that comes with your cancer. The emotional ups and downs are very normal. No one gets through this unscathed. We do know, right, that uncontrolled depression, uncontrolled anxiety, things that get really out of hand can impact things. So of course, if you have a patient who's in the depths of a really deep depression and they're not getting out of bed, they're not taking a shower, they're not showing up to their appointments, they're not taking their medication, they're not taking care of themselves, of course, that's going to impact their care and their outcomes in that way. However, the person who's optimistic and the person who, has some tears and has some tough moments and some very real worries and ups and downs, but is still getting through their treatment, those people are going to do just as well, embracing their emotions and the realities of the situation. And that whole idea that you have to be positive is really kind of a myth.
Well, that's good to hear, because, some people can't fake it, and they can't help how they feel, especially if it's been a long journey. So that actually is great to hear. But of course, we want to always encourage people to try to stay positive and look for help, therapy, loved ones, take things off your plate, all the things we know that make a difference so they can concentrate on their health, really, and get better.
Absolutely.
So side effects, you mentioned the side effects of CAR T. Can you talk about what you experienced? Because we know CAR T is a little bit different than a bone marrow stem cell transplant with some of the neurological testing that needs to take place. Can you touch on that, Liz?
Sure. I think many patients who have already been through a fair amount of, especially chemotherapy before they get to CAR T cell therapy, are actually a bit relieved to know that chemotherapy, I've heard some physicians, some patients refer to the chemotherapy they get before CAR T cell therapy as chemo light.
Okay.
They're actually kind of relieved to know that the chemotherapy given to kind of make a little bit of space for the CAR T cells comes with pretty low side effects. So the side effects for CAR T are so different in that the chemotherapy isn't as harsh as it is you prep for a stem cell transplant, where you're getting this very intensive chemotherapy that is just wiping out your whole system. But the side effects for CAR T are just so different in that you are looking at more of the neurotoxicity, neurological side effects that can impact your brain and your brain functioning. This cytokine release syndrome, which is very new to patients. It's sort of wait, what? So these CAR T cells are going to go to work and release stuff into my system that's going to cause inflammation, and that can cause these insane high fevers and aches and reactions in my body that could land me in the ICU. I mean, when you read the side effects for CAR T cell therapy, they're quite alarming. But then we have this kind of like strange juxtaposition of like a fair amount of patients getting through a little bit unscathed. Like, I wish you could see my face. I know, like, on a podcast, you can't see all of the hesitancy that my body is showing, where it's sort of like, there's all these potential side effects that could be really bad. And for some patients, there are serious side effects, seizures, all of these crazy things that can happen. And then we see patients that do quite well, see really phenomenal results, and not experience a lot of these potential side effects.
Okay. So how many people will end up in ICU, like a percentage of CAR T patients? Is it a very small number or half?
It's a minority.
Okay, good.
Anytime I ask our physicians, and they don't like to give like numbers, and it depends. I feel like the answer I always get is it depends.
Sure.
Like, it's like, is it a lymphoma patient? Is it a multiple myeloma patient? Is it a off-the-shelf CAR T product? Is it a trial CAR T? How much disease does the patient have before they go into CAR T? There's all of these variables that contribute to who has side effects and who doesn't, and pre-existing issues and all of these things, which I understand.
Mm-hmm.
But consistently, what I hear is it is a minority. It is a small minority of patients that have extreme, significant side effects that land them in the ICU and very ill and very sick.
Well, that is good to hear that it's a small number.
Yeah.
And as we're learning more and more about CAR T and there's more clinical trials, I just expect that it's going to get better and better.
Mm-hmm.
It's a very exciting time for this kind of therapy. So let's talk about caregivers. We know that they're amazing. And in a CAR T situation, there's fevers to contend with, some different side effects that really have to keep them on high alert. Any pearls of wisdom for these wonderful souls that take on this role?
Yeah. I think the best advice that I can give caregivers is to try to remember that they aren't doing this alone, and to remember that there is a care team here to support them. I know it probably feels like they're doing it alone because we're sort of like, read this manual, watch this education video now, go out there and let us know if you need anything. And it's sort of like, well, like sometimes I feel like we're sort of asking our caregivers to be a wife, be a brother, be a sister, be a kid, be whatever role you're in, a friend, but also be a nurse, be a doctor, be this caregiver, 24/7 and have this person's like health and life sort of in your hands, which feels like a very big task. So I tell caregivers a lot, program that clinic number in your phone. I ask caregivers all the time, if you have a question, if you are unsure, if you're seeing something and you're kind of like, I don't know, call. And who are you going to call? When you pick up your phone, what number do you need to have a phone number in there. You need to know a person on the team that you trust, that you have a relationship with. I say we have CAR T coordinators here that are like the glue. And so that's who I always advise that our caregivers call if they have a question. Lots of places have triage lines and things like that. But I'm always like, have that go-to person that you are emailing, calling, so that you don't have to do this alone and don't second guess yourself. It's always better to be over careful and ask or call if there's something that you don't know, and let us tell you, like, nope, that's not a concern. Don't worry about it. We'll see you at your next appointment, or
Let's get you in.
let's come on in. Like, just don't feel like you have to do it alone.
Well, and I have a basic question. So there's a coordinator. I'm sure that person works during the day. I would imagine you also want to give them a number for, in the evening, or is it the same number that somebody else takes over that role?
Like I said, we have a triage line where somebody covers it 24/7.
Great.
So you call it at 2:00 in the morning, and there's, an NP or usually a physician that's covering that 24/7 that can give advice. So I'm like, you call. That's what we're here for to let you know that, like, I don't know, it's 99.7. I can't remember. What are we supposed to do? Or, it's interesting because we here at our institution, we are entering the world of doing CAR T-cell therapy fully on an outpatient basis.
Okay.
And this is blowing my mind because
I bet.
right now we're admitting people for 7 to 10 days at least to watch the side effects and have our neurology team follow patients while they're in the hospital. And now we're going to put that a lot more onus on caregivers to be watching symptoms if we're going to do CAR T fully outpatient. And so,
wow,
I think there's going to be a lot more of relying on caregivers to be watching for something. I had a patient the other day have some facial drooping happening at home, and the caregiver noticed it before the patient did. And thank goodness she called and let our team know, and she did exactly the right thing.
Wow. And just teaching the caregivers to be, their own advocate. And like you're saying, to make them feel so comfortable making that phone call. That is wonderful to hear.
Yeah. And know that they have supports too. I mean, I know it's different by institution and by city and what's available, but I know things like cancer support communities or Gilda's clubs or BMT InfoNet. Know maybe what's available out there to connect with other caregivers.
Yes.
Who are going through the same things you are, so that you have your support. There's just so much emphasis on the patient that sometimes I just want to be like, what about our caregivers? Like, come here.
Yes.
Like, I got hugs for you too. Like, this stuff is not easy for caregivers either by any means.
And as you're saying, there's even more pressure on them if everything's outpatient.
Yeah.
But you know what? They're up for the challenge, I'm sure, when it's your loved one. Liz, what are some of the most significant psychological challenges that you're seeing on the daily with this?
With CAR T-cell therapy?
Yeah, with the CAR T.
I think probably after CAR T-cell therapy, the biggest psychological challenge, I think, is recurrence anxiety. Did this work? How long am I going to get? I think I see this a lot, especially in the multiple myeloma group of patients that are always playing this game of like, what's going on with myeloma? How much time am I going to get from this chemo? How much time am I going to get from this auto transplant? How much time am I going to pull from this CAR T? How much time until I got to do the next thing? And it's really interesting, the subset of patients that can sort of compartmentalize that, put it away and say, I'm going to live my life and not think about that. Whatever elixir they have, I want some because my brain certainly does not work like that. So I really feel for the patients who worry about those things. I think I'm like, I get that. My brain is a worry brain too. So I understand tremendously the weight of recurrence anxiety. And I think that is one of the biggest psychological challenges because it's real. Like, you can't talk someone out of the what if because no one can give you a 100% guarantee that your cancer's not going to come back.
Sure.
And so figuring out how you live life moving forward with that anxiety or that worry becomes quite a challenge, and a place where psychologists are great, or counselors or clinical social workers or support groups or mentors. Like, there's so many different types of helpers. Like, psychologists were one piece of it, but there are a lot of helpers out there, your friends, you're, engaging in the things that give you meaning and distractions and all. Like, there's so many ways to work through the emotional, psychological part of things. But I think that's one of the biggest emotional challenges. Some people are pretty disrupted sleep-wise.
Okay.
I could talk all day about sleep issues and how much we just really ruin people's sleep with medications, with steroids, with hospitalizations. And so I do spend quite a bit of my day helping people treat their insomnia and their sleep issues. That can be quite a challenge getting that back on track afterwards, after CAR T-cell therapy. But I really do think the anxiety and sort of figuring out, okay, how do I reset? How do I navigate my survivorship and find normalcy?
Yeah.
And meaning? Like, what does that look like?
Exactly. I have a great survivor who took up crafting in her survivorship, and she keeps sending me pictures of the beautiful things she's making. We're going to do a class with her next year. And she said it's really just made such a difference, taking all that energy and pouring it into different projects. So I do believe there's a lot to be said for that. We have a healing arts program that we do,
Awesome.
book club. So, chances for people to think about something else besides their cancer.
Absolutely. And there's no playbook either after these things. Like, I think patients are really accustomed to having a step-by-step guide, directions, being told what to do. You do this chemo, you come on these days, you do this transplant, you follow these rules, you do this CAR T, you come on these days, we tell you what to do at this time. Like, there's all of these step-by-step things to do. And then when it's over, there's no direction, there's no compass. And people are like, why does this feel harder than anything else when I should just be like grateful that I'm alive, but I'm totally lost? I cannot tell you how often patients tell me that they feel a little lost in sorting out how to kind of get their lives back on track with this sort of like, great, CAR T worked, you're in remission, get out of here. And it's like, well, but where?
Yeah.
How? Like, what?
And how can we all, as friends of people that are going through that, how can we help as friends? Maybe not the caregiver, but even just a good friend.
Yeah, I think just the recognition that the chapter may be closed, but the story is not done.
Oh, I like that, Liz.
Yeah, I think most people will say, like, my friends and family think that this is just over, and it isn't yet.
Yeah. And making them feel validated, right?
Yeah, just listen.
Yeah, we did a program where one of the gentlemen said, I wish that my friends could hop on right now. It was a coffee clutch. And he said, I wish they could hear all of you. I wish I could tell them what you're all saying so they would know how I feel better. It was very powerful. What I wish you knew about my GVHD was really what he meant. So yeah, it's being a good listener and not trying to just fix it. I have so many survivors say, I just want to be heard.
Yeah, that says it all. And a true, how are you? Like, sometimes I say, like, we go around asking each other, like, how are you? How's it going? How's it going? How are you? What's up? And I say, I tell people to say, like, how are you? How are you? Like, how are you? Really, how are you?
Yes.
I'm here to listen about how you are for real. I'm not asking in the like passing by kind of way. I really want to know how you are.
Yes.
And sometimes it takes that intentional asking to get somebody to feel like, oh, this person really does want to know. They don't want to just hear the like, fine, I'm okay.
Well, Liz, that's probably why you are so amazing at your job. That is so true. We all say that in passing. It's really become a greeting.
It is.
Instead of a question, if you think about it.
Yeah.
This has been just so wonderful. I'm so thankful that you would share all of this today. As CAR T is proven over time, do you think it is getting easier for patients to feel a little more at ease as the years go by?
I think so. I think it's going to get easier. We clearly are getting better at it if we are able to offer this in an outpatient setting. I'm sorry, my mind is still reeling that we can do this. I think back to when I started doing this work many years ago, and we were still doing autologous stem cell transplants inpatient, and we do those on an outpatient basis. So things just keep getting better and keep evolving, and they naturally get easier, which means the emotional and psychological load gets easier the better we get at making things physically easier and perfecting treatments so they aren't so chocked full of terrible side effects. If we can find a way to solve GVHD, oh man, that'd be something.
Yeah, that would be amazing for sure.
That would really be it.
Well, and there's no GVHD with the CAR T. So right there, that's something to be said, right?
Absolutely. Absolutely.
So Liz, as we wrap things up, is there maybe a story about a patient that you want to share?
Yes, I had a patient just like a week or two ago that I saw for a pre-transplant evaluation. We see all the patients who are getting ready for CAR T-cell therapy or an auto or an allo transplant. And it was the first patient in a long time that was the patient and his wife, who's the caregiver. They were very apprehensive about CAR T.
Okay.
They were like, we don't know if we want to do it. We're really hesitant. And most patients are like, we're ready. We want to bring it on. Yes. But it was a multiple myeloma patient who had been diagnosed in like 2016, had been through a bunch of chemotherapy and a really challenging auto transplant. And the side effects were horrendous. The patient had been in the hospital for, I think, like 3 months. The patient was horribly depressed. His caregiver, I mean, she was like, taking care of him was the hardest thing I have ever had to do because he was so incredibly sick. He did not recover from his transplant well. It took well over a year. The emotional toll on him took an emotional toll on me. And she was like, I don't think I can do it. Like, I don't think I can caregive for him again through another major treatment.
Okay.
And so they came into it really sort of like, he was like, I don't know if I want to do CAR T. She was like, I don't think I can caregive for my husband through another major treatment. And so it was just sort of a, like, oh, I don't know if we want to do this. And so they just needed, I think, some additional education. Like, I think their previous experience was coloring what they were hearing. And so the medical team really sat down and kind of talked through, like, this is going to be vastly a different experience than the auto transplant. And kind of reiterated that, like, we don't anticipate that you will have major side effects. Like, we really think we're setting you up for success. A long story short, he got his CAR T-cell infusion last week and got out of the hospital early. 0 side effects.
Oh, wow.
Doing really well. Great response thus far. Really smoothly went through. And so that was really great. Had another, like, similar experience where really challenging auto that had set the patient up for not wanting to do CAR T, ended up doing CAR T and was kind of coming back around to doing another CAR T cell therapy option on trial. That was a new trial that's targeting like a new protein in myeloma. And I thought, wow, that's kind of showing that we are progressing.
Mm-hmm.
It's showing that, especially for myeloma in CAR T, that, like, if you can kind of live to fight another day, that over the course of these years, it may feel like buying time, but if you do, there is more. Like, we're bursting at the seams with CAR T cell therapy, and that this patient had CAR T in 2022.
Uh-huh.
And now 2 years later, there's another CAR T product on trial available to him that's targeting his myeloma in a different way than was available 2 years ago, which I think is really incredible.
That really is. Wow.
Yeah.
So much hope.
Yeah. It's incredible.
Oh, this is so great. Thank you for sharing that. Well, Liz, I just loved everything you said. This was tremendous and appreciated. Thank you for being with us today.
Yeah. Thank you so much for having me.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.